And welcome to Health Options. I am Rabi, Abdallah. It's good to have you join us on the program. A high-level meeting on universal health coverage was one of the side events held at the 74th United Nations General Assembly in New York. The meeting, with the theme Universal Health Coverage, Moving Together to Build a Healthier World, brought together political and health leaders, policymakers and universal health coverage champions to advocate for health for all. There was a clarion call for equitable and inclusive economic growth, as well as the need for countries from all regions and at all levels of income to mobilize more domestic resources, increase the equity and efficiency of existing resources, harmonize investments in health, and establish and accelerate multi-sectoral and multi-stakeholder action and sustained investment to achieve universal health coverage by 2030. On this episode of Health Options, we take a look at how the clarion call can translate to action effectively in the various aspects of the Nigerian health sector in terms of service delivery. We beam our searchlight on the HIV and AIDS national response for status. Before then is this report on the high-level meeting on universal health coverage held at the 74th United Nations General Assembly. Universal health coverage means that all people and communities receive the quality health services they need without financial hardship. Findings, however, show that globally, about 100 million people are pushed into extreme poverty each year because of out-of-pocket spending on health. Universal health coverage remains a top priority in the global agenda and an integral part of the Sustainable Development Goals. Hence, the task before nations.
Everyone, everywhere, has the right to accessible, high-quality, affordable care that promotes physical and mental health and addresses the needs of women and men, girls and boys, including during conflict and humanitarian crises. Shockingly, half of the world's people are still waiting to exercise that right, and this has serious consequences for all of humanity.
The objective of universal health coverage is to strengthen our health systems, beginning with primary health care. We must continue to work to guarantee healthier lives for everyone by ensuring that people have access to, among others, affordable, preventive, curative, and rehabilitative health services.
Although Nigeria has been struggling to join the rest of the world in the quest for universal health coverage as far back as 2005, progress has, however, been quite slow. As 14 years down the lane, the scheme has only been able to meet the needs of less than 5% of Nigeria's population of 200 million people.
Government should review the NHS, make it compulsory. People are disappointed. We go to the hospital, it's still the same story. Some drugs are not issued to you because you are using NHS.
If I'm working and I'm having this national health insurance scheme, it should cover my family members up to the least person I have. And if I have a big problem like surgery or transplant, at least the health insurance scheme should cover up to that, not just when you're having malaria, typhoid, or all these minor sicknesses.
However, the demonstration of political will and renewed impetus on universal health coverage on the part of the federal government is readily seen in the implementation of the National Basic Healthcare Provision Fund, which saw the recent disbursement of over 6 billion naira to 15 states and the Federal Capital Territory for states' health insurance scheme.
If you follow the money, follow it to the point where it gives the immunization, to the point where it gives family planning, to a point where it pays for basic health needs. That's where we'll be starting, but within the provisions of the law. Follow the money. And following the money simply means you have to have proper documentation. We call it costed plan, because after you do budget is sort of costed plan, but you have to have implementation plans and things like that. And if you do all those things, and it's very tedious, It's tedious, but it's doable. Tracking these things, something like independent verification, you cannot monitor yourself. So if you have put the program down, it's not your system or your governance system that you go and do the monitoring. So you have to get people who are independent to monitor and tell you the truth. And I think that should be the way to go. You should take it slowly. There are resources. The tendency is money day. Let's spend it. Because you know the amount of money they were giving from the Basic Care Fund. It's about 20-something billion. And this year they'll give them another one. But what does that pay for? I said before, I want to see NHI said confine themselves to the provision of the Act to pay for basic minimum package for all Nigerians. And like I said, even if it's to pay for malaria, you know that's what you are starting with. And it's for all Nigerians. The next is how do we track it? And because this thing is not just through public health facilities. Private health facilities are supposed to be part of it, is in the Act. So that we start from somewhere. I don't mind starting from the scratch again, so that we can see clearly where we are heading to.
Health is considered to be a human right for everyone at every age. And with me in the studio to take us through the discussion is the Director General of the National Agency for the Control of AIDS, NACA, Dr. Aliyu Gambo Gumel. Thanks for joining us on Health Options, Dr. Gambo.
Thank you, Rabi, for inviting me.
All right.
Glad to be here.
Glad to have you here.
Thank you.
Yeah, universal health coverage, as we all know, is a global concept, and the whole world is tilted towards that direction. And we know that Nigeria has been making efforts within its own level to be among countries that are really, doing the needful. And I know you were one of the participants at the 74th United Nations General Assembly, which was concluded a few weeks ago. And of course, there's so much emphasis. There was more of a clarion call. We saw our own Professor, Bande, calling on governments and nations to invest in health, to step up actions and all of that. And we know that back home, our national HIV and AIDS response has been making progress. Of course, we know where we are thanks to the survey that you and your team consulted that moved us from where we were. You're going to shed light on that survey in the course of this discussion. But in terms of universal health coverage as it relates to HIV and AIDS, where are we and what are we doing in view of this clarion call for us to step up actions?
So, in terms of health coverage for HIV services, I can say now we have enough services, and we're looking for people to access them. What I want to say
Does
is
it
that
include ARVs? Because I know not everybody needing ARV is accessing it.
Inclusive of ARVs.
Okay.
And this is the story. For the past 15 years, HIV services in the country, in terms of prevention and treatment, is driven by donor. 80 to 85% of the money that is spent for HIV services comes from donor agencies, and we know this is not sustainable. One good thing we learn from UNGA, 74th UNGA, is how private organizations mobilize resources to derive services, health services globally, and now this is the trend. Even where communities or places where resources are abundant, is huge and is much for the government to take that responsibility of providing health for all or universal coverage for all. So private sector has critical role to play. And domestically here, what we are looking at is the model we have, we know is working and is working very well. But the question is it sustainable? Are we going to continue to have this amount of money coming into Nigeria supporting HIV services?
Talking about donor support now.
Talking about donor support.
Okay.
So we don't know it's not going to be sustainable. So what are we planning to do? in the event that this money ceases to exist, and it will definitely cease to exist, perhaps gradually. This is our hope, that if it is ceasing, it will not cease abruptly. It will be gradual, and that gradual withdrawal will allow us to fill in the gap. And our focus now is in the private sector, looking at how we work with private organizations to increase spendings or funding, private funding for HIV activities. At the current rate, is less than 1%. Yeah, so we want to see in the next 1 year or two if that can be increased to 10 to 20%, and that would be good news.
Okay, so it's good to know, but of course we know the benefits of Nigeria taking ownership of funding, local and the domestic ownership for funding, and talking about private sector involvement. Do you already have a strategy, or you have something in the pipeline that what are those hanging fruits that you could tap into in that regard?
So the good thing is there is an association of private sector organizations, NIBUCA, that have been contributing to HIV activities in country. So we're using the same NIBUCA now as a vehicle to come up with what we call HIV Trust Fund. And this HIV Trust Fund, when it comes to fruition, will be kind of money put together by private organizations to provide HIV services, and the demand will come from the government, who will tell this trust fund, these are our requests, and the trust fund will use the money to provide the services we need, for instance, in drugs, ARVs, kits. So if we have those services provided, it means we will look up to providing clinical services at facilities, providing testing services, at facilities, but drugs are out, and drugs and the kits are the major commodities in ARV or HIV sector that we feel we can run out, without money at any time.
Okay, I am more worried about the aspect of prevention of mother-to-child transmission of the virus now. I know that Nigeria, still accounts for countries that really don't reek of, pleasant statistics when it comes to that. How are we addressing that, or to see that we move from where we were in that regard?
So there is an arrangement by Primary Healthcare Development Agency here in Nigeria. Basic Healthcare Fund is one avenue that we can seek to improve access to primary health services at primary care facilities. And this will involve or include PMTCT, Prevention of Mother-to-Child Transmission of HIV. Encouraging pregnant women to go to these facilities and access antenatal services will help greatly, in giving them access to HIV services at early stage of the pregnancy, to have HIV testing to identify those that are HIV positive, and provided them the needed services while they are pregnant and immediately after delivery, following delivery of their babies, to ensure that their HIV does not leave their body to go into their babies.
Okay, I didn't quite get, at the beginning of the discussion, I had said I'm aware of the fact that it's not everybody needing ARVs that has access to it or that is accessing it, and you said people are even now that you're waiting for people to demand for services or something. Maybe if you could just maybe shed more light on that. So we have everybody requiring ARVs in the country accessing. It's all about universal health coverage, where one should not think about the size of the amount he has in his pocket before accessing health. Is that what obtains?
Yes, so ARV services are available and they're accessible and they are free. They are there at our facilities, health facilities nationwide, and it's a matter of people coming forward to access them. They getting to know those people. They either don't know they have HIV and they're carrying it, or they know they HIV, but they don't want to come to our facilities medication, perhaps probably because of stigma. This stigma can come from healthcare providers, it can come from their relations, spouses, it can come from their employers. our last mile client.
Yes.
We got this information from NICE, and what we are looking at now is how 9 million or thereabout we living with HIV.
Let me just say the survey.
That are accessing or have reported themselves, or we have data that are receiving or accessing. So, yeah, and this working encourage people to come out to test for one of the please do nothing. The about no status is if you know yourself and you his HIV, he or she is HIV positive, and get access to treatment. What will make what we are people take advantage of. If you have HIV and you assess this treatment and you are consistent with the treatment, doctors are seeing you and they are evaluating you, they are testing the in you, they will help
The next question. I'm asking you for time. In terms of claims by people who claim, who are claims of having cure for HIV, some have been accusing Nigeria of giving them growth to look at their work. What's the situation?
So, as government, we will be to promote Nigerian scientists, but under the condition that the science is genuine. And what I mean by genuine is there are individuals globally that accept for every scientific discovery. Not, I have discovered this and explain to scientific. And at the same time, if it is most subject, you introduce beings not getting necessary approvals and passing through the history behind that. Have passed this stage where people will walk over it and use other people as guinea pigs. But how sure are you that if you introduce product into human beings and it ends up killing human being instead of getting them cured or this, what you end up more harm than good to the individual you are trying to save or trying to help. You start trying animals and see the effect. And if probably investigation to drop, you have to be seen. But when you come to human beings, there may be no effect. So, but if it is safe, if you apply it in human being and it is safe, if there is no effect, people will not have issues with that. But if you apply it in human being, there is no there are no effects, and at the same time there are harm, then people have issues with this. To prevent that, you pass it through regulatory agencies, the ethical committees and regulatory agencies will review your work. And then they will work with you and will tell you, okay, we agree with this, this can now proceed to the next stage. There are stages, and all these stages are designed to protect science. drugs or whatever observe. It's good to make observation, and when you observation, you can remove something. So if there are such problems, we'll be happy to now that the and then the and this them use them that are very encouraging is our pride. Is for us now propagate and tell the whole world that we have this product, and this product is found to be effective and efficient, and your sense, you don't humble, then you're committing crime, you're not promoting science.
So let's quickly talk about post and pre-exposure prophylaxis. In fact, a lot of people have mistaken it for a cure. They tell you, especially the what do you call the post-exposure prophylaxis. Just for quickly explain it for the layman's understanding.
So we call whatever,
especially in the fact that you have a lot of rape cases being reported, abuse of minors and all of that. How available are such services?
So post-exposure prophylaxis services are available, and whenever there are those cases of rape and similar cases where there may be risks of HIV transmission as a result of such behaviors, these things should be reported. And we have our site at NACA that can take care of this and can guide in terms of giving information. We have a hotline that people can call. When you call 6222 from 8 a.m. to 8 p.m., somebody will be
HIV. How close are we?
Vaccine, because it's unlike vaccine provided for HIV in particular. Probably the answer to HIV should be something outside vaccine. And this is what there's genetic engineering the scientists are working on now. What they are doing is creating a kind of a competitor to HIV virus. This competitor will occupy the CD4 cell counts. The CD4 cells that usually HIV attacks, preventing or denying the real HIV access to the cells. And there is a receptor editing, where the receptors that HIV use to get into the cells will be edited in such way that HIV will find it very difficult to penetrate. So a couple of them were presented at the last IAS meeting, and they were encouraging. Next 5 to 10 years, probably something promising will be out.
Okay. All right. Thank you so much for us.
Thank you, Rabi.
This episode of options, a quick reminder that you can channel, watch upload of these and other episodes of the program for comments on health options at Abdallah. Many thanks for watching. Hope to see you again.
Nigerians, suicide bombers are not spirits. They are not ghosts. They are human beings like you and me. They live amongst us. Are your neighbors. They are your friends today, parents tomorrow. So you must know your neighbor now. Security begins